Greetings and welcome to the International Pediatric Simulation Society podcast. This show is for people passionate about pediatric simulation-based education, training, and research. Podcast hosts are members of IPSS, a global community of multidisciplinary healthcare professionals from over 30 countries, all dedicated to improving the care of infants and children worldwide. Each week, one of our sub-hosts, Christine Bailey, Elaine Ng, Erin Carn-Bennett, and myself, Samreen Vora, will introduce you to a new guest and bring you into a conversation with simulationists and healthcare professionals from across the world. Come along. Welcome to our IPSS podcast. We are so excited to have all of you join us for this inaugural episode, and you'll be meeting all of our sub-hosts today, starting with me, Samreen Vora, and I'm really excited to be here. A little bit about me. I am in transition right now, and so I was the medical director of simulation at Children's Minnesota for 7 years and have now transitioned in a move to Connecticut as the director of interprofessional simulation education at Yale Medical School and Yale New Haven Hospital. So I have a lot to share as we go into these episodes about all my experiences across that spectrum. And I'm excited to have you meet our other hosts today. And I'll hand it to you, Elaine.
Hi, everyone. My name is Elaine Ng. I'm a pediatric anesthesiologist at the Hospital for Sick Children in Toronto, Canada. So I've been with IPSS, for years, 2009, 2010. For a long time, passionate about simulation, obviously, otherwise I wouldn't be here. I'm the lead quality safety at my hospital, simulation steering committee. I do a lot of simulation training with our residents, our nurses in the perioperative area, and also trauma simulation. That's about it for me. Christine?
Thank you, Elaine. So I'm Christine Bailey. I'm a senior simulation educator at Children's Hospital of Philadelphia. I have worked with IPSS for a little bit over 2 years as co-chair of the education committee. And I'm so thrilled and excited to be collaborating and learning from other pediatric simulationists across the world. As I said, my background was with pediatric intensive care unit nursing. And it's just been a thrill to understand where the real issues are, how we're helping advanced critical care nursing and the field of pediatrics, and so happy to be here. So thank you so much.
Kia ora. My name is Erin Carn-Bennett. I'm a simulation nurse educator with the Douglas Starship Simulation Program all the way down in Auckland, New Zealand. I have been in simulation since 2019, and my background is children's emergency nursing for 16 years in total as well. I've been a member of IPSS since 2019, so I'm still fairly new to IPSS. I'm very fortunate to kind of be following in the footsteps of a lot of other Kiwi simulationists that have been very involved in IPSS, like Shepherd, Trish Wood, Joe Hegarty, Gabrielle Nuttall. They really forged the way for our program in IPSS, and I'm also on the board of directors, and I just love IPSS so far. It's been an amazing experience. Everyone's incredibly welcoming and giving and sharing. My first conference in Lisbon last year, and it was such an amazing experience. We were fortunate enough to have our whole New Zealand team travel up there. There was lots of memorable things, and it's just such an amazing community to be alongside. And you sort of oh my god, there's Todd Chang, and it's not, it's a smaller, more intimate conference, and you're just oh my gosh, wow. And it's just such a cool vibe and such a cool thing to be involved with.
I hope that everybody can hear the excitement and the love that's just dripping all of our words, because I was oh my gosh, we are all so excited to represent IPSS and really have everybody kind of learn with us on this journey through this podcast. So that was really cool. And I loved, Erin, what you just shared, because that was my journey to IPSS too, of one of my first conferences before I came. I had actually trained in general EM, so I didn't know, and my fellowship, my sim fellowship was kind of general sim, right? And so a lot of what I did was adult sim, and I didn't know all the names and the folks in peds. And when I started at my job at Children's, my colleague would be like, oh, and so, and all these names. And then I got to go to IPSS and I was like starstruck, exactly what you said. And I was like, oh my gosh, like I can actually access these people and learn from them, grow for them, and that from them and with them. And that was my journey as well over the last, kind of 10 years ish, 7, 8 years now. So that was really cool. I'd love to hear, I know Elaine, you had shared a little bit about your kind of memorable IPSS experience as well, if you want to share about that.
Yeah, I was just about to say that we, just the four of us, we are from different countries. So that's pretty cool. And there's the travel aspect. I can't believe Lisbon was your first conference. That's a long way for you to travel too. But for us, going to Europe is also very novel and exciting. So there was a travel aspect. You meet people from all over, the names of names in simulation. But for me, back in Madrid, when we went for a conference, so I did the whole travel thing. I started in Barcelona first and then went to Madrid. I did some cooking classes, a chocolate tasting class, all that kind of stuff, and then got to serious work. And I went to the conference by myself. And then I met other people from Canada. And they say, hey, you want to come for dinner? I said, yeah, okay. And then from then, there were other Canadian meetings. I got to meet other people in simulation. So that you keep seeing the same people over and over again, and you build this friendship. And then you say, I don't know what I'm doing. Can you just tell me? And, the simulation world is very giving. So then you get to know things and you get some freebies because you just need help with something. So I can help you with that. I can give you that PowerPoint. I can tell you how to do this. No problem. So it's been a very wonderful journey being in this very, very collaborative society. And I think I like the size of it. We're not huge. What's the membership? Like several hundred people? So it's good. You keep seeing the same people at the conference. Everybody's excited about it. There's a lot of sharing. I'm looking forward to every conference. And of course, we now have the IPSS V as well, the virtual conference. And being on the board, get you to have an opportunity to contribute to the organization. I'm happy to contribute. I think it's well worth my time.
I think that I heard, Elaine, you kind of reiterate, Christine, what you had shared about IPSS and just being connected. I feel like we all that was a common theme. If we were to do a qualitative study of what we just talked about, connection is definitely one of the themes, and growth, I think. And I know you talked a little bit about that, Christine. And how long, I hadn't realized, Erin, your first one was Lisbon. So I don't know, Christine, how long have you been coming to IPSS or how long have you been part of IPSSW or IPSS and coming to IPSS? The W is for workshop, if anybody didn't know.
Thank you. I went to the first one in Tampa and I was so amazed. I loved it. It always seemed like, as a nurse and not a healthcare provider, it always seemed so intangible to me, but I still felt like part of my role was to encourage the interprofessional team to engage in pediatric simulations. And I loved it. I loved the opportunity. I loved the energy, the discussion with how passionate the physicians were and the respiratory therapists were about how do we make something meaningful to influence patient outcomes. And for me, that was just like a push I want to be involved in more. I want to help. I want to learn. I want to have more education. Like, how do I help foster that education for other people like myself who are background in nursing, but also we're simulation educators. I have my CHESI. I'm applying for my CHESI A. How do I grow that capabilities with other disciplines so that we can keep that accreditation? We're not just about a single discipline. We're not multidisciplinary. We're interprofessional.
I love that.
Tell me a little about this CHESI thing, Christine. I'm not familiar.
So CHESI, this is like the standard for healthcare and simulation, is that as an educator, what are the standards to say, like, I am doing all the right things, I am building all the right capabilities for the different clinical services that I serve. I mean, I work with nurses and physicians and respiratory therapists, and we do research and we do system and process testing. And how do I know that I am reaching all of these disciplines within the healthcare system to the fullest capability? So that really had a message for me of, I want to do what is known to get this capability. And what is known is accreditation. It's about achieving a certification. And so I got that certification for JESI. And now my next step is, it's not just about knowing, like, the knowledge behind everything, but it's about the systems and the collegialship. I can't say that word, sorry. But
I don't think any of us can.
building
It's
those.
okay.
Thank you. It's about building those collaborations and building capabilities within our healthcare systems to be able to educate, to improve patient outcomes, to do research. I don't know. It was so exciting. I'm very much on board for getting my CHESIA. And Elaine, you had a question or a comment.
So, Christine, so I remember when you were so excited at your first IPSSW, and then you quickly volunteered to be on the education committee, and then you said, I could be co-chair. So that's all very exciting.
I loved, like, the welcoming collaboration. I've been so excited. I started simulation in the pediatric ICU, and I was welcomed in by one of our critical care attendings, Akira Nishizaki, who wanted to make simulation more about interprofessional collaboration. How are we working together? How are the pediatric teams working together to improve patient outcomes? And I was thrilled to be invited and welcome in and help to build the capabilities of our clinical teams, as well as within, like, the knowledge of simulation, but also to understand, like, how do we facilitate and co-facilitate simulations. There was no other choice for me than to be part of IPSS, because everything that we're doing is, we're talking about, like, people that are the movers and the shakers, people that are doing the things that are influencing how we're caring for children, how we're training our interprofessional colleagues to care for children. There's nothing else in the world that compares to this, and so exciting to be part of it. So thank you.
So what do you hope that we can achieve with these podcasts as chair of the education committee?
I feel like, as chair of the education committee, I want to keep people inspired about, like, why are we here? What are we doing? How can we keep moving our practice forward? How can we advance simulation practice that we're doing to improve what we're doing, how we're delivering care, how we're improving children's outcomes, how we're working together to figure out, like, what are the best practices for patient safety, for patient outcomes, for harm prevention? How do we show that return on investment as a community, as a society? I feel like it's so important.
I think that is really cool to just hear that passion, and you just talking about the interprofessional work and just the importance of different professions. And even we talked about our internationality of, like, all of us being from different places. And I heard earlier, Erin, you mentioned that your whole team got to come to that first IPSS W in Lisbon. And so I imagine it was pretty interdisciplinary. I don't know if you wanted to talk a little bit about your experience with that and your work and all of that as well.
Sure. Thanks, Samreen. So, yeah, we were incredibly fortunate as a team to be sponsored by the Starship Foundation to be able to all come over to Lisbon. So it was a very, very special occasion for all of us to be able to go together. I believe there was like 8 of us that came over. And so it was like 30 hours in a plane from little old New Zealand. And there was a couple of things that really stood out for me. So I presented a poster with Dr. Kangi Gang on a leadership training program that we had designed ourselves, but we were really stuck. So it was like a work in progress, but we got to a point with it where we didn't know how to proceed. It was a bit of a simulation fruit salad. We knew it was a thing, but we didn't know what to do with it. And so we presented on it, and we got given some amazing feedback on our poster of how to solve this conundrum that we were in. And now we've ended up creating this program called Sim to Lead, which has the foundations of it came from the advice that we were given from the poster presentation from world leading experts. So that was kind of like a game changer for Cam and I. That was awesome. Obviously, really, really amazing for team building, all being in Lisbon together. And there's sort of like a little bit of a history with the New Zealanders going to IPSSW, that there's a catch up with the Australians and the New Zealanders, that we have quite a large dinner on one of the nights all together. So that was nice to experience that as well, because, you know, as much as we sort of, you know, pay out the Aussies and give them a little bit of grief, we do actually really enjoy their company and love to do simulation with them. So that was super fun. But yeah, I mean, as I've kind of alluded to before, it was quite interesting. You know, I remember watching Todd Chang's closing keynote and being very starstruck. Oh my God, that's Todd Chang! And he was presenting on VR simulation. And one of my colleagues, Alison Cartwright, she had presented a verbal presentation about something that she thought VR could be used for. And so we were all, go on, Alison, go and give him your business card. And she was like, no. And then she went up and had a chat with Todd and gave him her business card. And then we've ended up interviewing him on our podcast, Sim Nurse NZ. And so now we're like buddies with the guy, you know, like it was just such an amazing experience to go from, wow, there's this like superstar in simulation who just seems like totally untouchable, to now we're like chatting to him at conference, and now he's come on our podcast, you know, and it's like that's all come about because of IPSS. So that's pretty cool, you know. And I mean, there's just, yeah, all these big players everywhere when you come to IPSSW. So it's pretty exciting.
I have a pretty similar story, even not so starstruck with seeing these people, but, you know, there's so many conferences, there's so many sessions at the conference that conflicts can't go to. I remember I just thought, maybe I just email Samreen. She seems quite approachable. Maybe she'll just send me her presentation. I couldn't make it to that session. So like, let me just email and see what she says, because I had a few conversations. She seems easygoing enough. So I said, Samreen and she sent me the whole thing. It's like, oh my God, that's amazing. That was you before we became buddies here.
I was really hoping the end of that story was that I sent you the presentation. I was like, oh my gosh, where's this story going? I love that. Well, we are definitely now friends, so this is good. Any presentation your way, Elaine. I love that. I love how, I mean, it's full circle to what we talked about right at the beginning, right? I think IPSS is this place for not just connection, but I loved your story, Erin, about that growth, right? To go that you flew 30 hours. I don't know if you saw my face when you said that. I was like, oh my gosh, like that was a long ways to go, but you found this incredible solution with that IPSSW community. And I think that is really the core of who we are, the collaborativeness that exists and the connection and the approachability. I feel like we've all that's what we've all spoken to. And I think that's just really amazing. One of the things that, you know, I imagine some of our listeners are like, yeah, well, that's all great. And it's really hard to get there, right? We all have our own full-time jobs. We all have a million other things. That's why I was like, oh, Elaine, I hope the end of that story is I sent that presentation, because with all the other things that was going on. And so how do we, I guess that's a question for any of you to kind of pick up. How do you balance that, right? The value of this is clear, I think. And how do you fit it in to all the other things that you're trying to do and accomplish?
I think one key thing is to make it fun. Share the load. So for you to send me your thing was the spark. I still have to modify it and do it locally, but at least I got started. At the very least, it was like more support. I gotcha. Even if it's not the content, never mind. If I want to do something, I know there's a resource there, a human who has my back to help me out. And then you go to conferences, you hear things, you talk to people, you get updated. It's impossible to do it all. Okay, impossible for me to do it all, to be up to date with all the literature and to know what's going on, because we all have our day jobs. But I think collaboratively is much more fun. And I feel like I'm up to speed. And that's probably why, like, you read some of the abstracts at the posters, you go to some of the workshops, just have a conversation over coffee. It's all great. And if you can't make it to the conference, there is the virtual conference, so you can actually attend. This is why we like to keep pushing on IPSS with the webinars, and now the podcast, just so that, something for everyone, I hope. So we'll keep building it.
I love that. Yeah. Offering it in flexible ways, inclusive ways that resonate with different people in different spaces in their life, and making it fun. I like that. I like that advice. Christine, do you want to add to that or share your thoughts too?
I was just saying, like, it's fantastic to be able to keep the conversation going. It's just interesting, like, once you hit a topic, to know, like, let's just open it up and just explore it a little bit more about what we're creating, what our vision is, how are we moving forward, what are the new capabilities within pediatric simulation?
Yeah, I think that IPSS everyone is so sharing and giving and helpful, and I love to then go and stalk everyone online and on LinkedIn and X in particular, and kind of like share everyone's amazing things that they're up to and sort of stalk them and see what else is going on and try and keep updated that way. And then obviously there's things, as Elaine's alluded to, like IPSS V, and then all of the webinars and things as well. If you can get involved in one of the committees and maybe even like the board or things like that then takes it to the next level. Samreen, I attended your workshop at IPSSW on your DEI toolkit, and that was like a game changer for our team. We're hopefully one day going to get to the space of being able to deliver a New Zealand sort of version of that. And it was like, oh my God, that's Samreen, and she's got all these credentials, and she delivered this phenomenal workshop. And then now with, the more involved that I've become in IPSS, it's like, oh yeah, Samreen and I like email, we're friends, So it's cool. It's like the more involved that you get, the more that you get out of it from those international connections. It's really, really cool.
I love that. I would have never thought people would be excited to meet me. And of course the work that you all saw was, for my entire team at that time and many folks that contributed, but it's really cool to see it cross international lines, right? Because ultimately we know that the work we do, sim saves lives, right? And so really it translates right to that bedside and those patients that we're seeing ultimately. So it's really cool to hear that.
So one of my colleagues and friend at my hospital has been doing a lot of work on culture and simulation. Culture as in the hierarchy and what we think is expected of our role, and how that affects simulation, how we affect teaching, and what we need to be mindful of. So I'm going to bring her on for one of our episodes.
I'm excited to have our human factors professionals talk about what the field of human factors, because it blew my mind. I had no idea about how human factors and simulation can collaborate together, and different lenses of looking about clinical experiences and how we're all interacting within our clinical environments and the patients that we care for.
I'm going to be excited to bring forward an episode about psychological safety. So the importance of it, particularly in every day in general, but also, within the context of simulation, how do we ensure that the simulation that we deliver is psychologically safe, and hopefully a lot of, take-home tips of how to do that.
Awesome. So much exciting stuff coming on the upcoming episode. So please join us again, and you'll get to hear from our wonderful guests that we'll be having on all the topics. Thank you again for joining us. Thank you for listening to this episode of the IPSS podcast. A special thanks to our behind-the-scenes producer, the talented Danish Kumar, and to the Starship Foundation for providing the equipment that makes this podcast possible.
Join us next time.